Hello, everyone. My name is Sierra Smith. I am a junior psychology major, and I currently attend Hampton University. And today we're going to talk about neurofeedback, a treatment for attention deficit hyperactivity disorder. Welcome to the brain, the primary organ of the body. The brain serves as the creator of all behaviors as well as the motivation to learn and complete other types of cognitive functions. When there are chemical imbalances in the brain, they can cause learning disabilities such as attention deficit hyperactivity disorder. ADHD is a psychological behavioral disorder making itself known by patterns of inattention, hyperactivity, impulsiveness, and some other symptoms. In order to be diagnosed with ADHD, impairments such as those mentioned have to have negative effects on social, academic, or occupational functions before the age of 7. According to the multimodal treatment study of ADHD, 3 to 5% of school-age children are diagnosed with ADHD. The anterior cingulate cortex. This area of the brain is found to be part of a circuit that regulates emotional and cognitive functions. Cognitive and emotional influences in anterior cingulate cortex by Bush, Liu, and Posner proposed three main ideas to support that this part of the brain plays a major role in the development and processing of cognitive and emotional functioning. Researchers found that the cingulate cortex surrounds different subdivisions in charge of cognitive, motor, and emotional functions. Anterior is described as executive, while posterior is described as evaluative. Neuroimaging techniques such as the PET scan and the fMRI have supported this idea. Over time, different researchers have used neurofeedback as a treatment for ADHD. Fox, Starp, and Fox attempt to examine the treatment of neurofeedback as well as compare it to other treatments that can be used for ADHD. They found that with an EEG, one will be able to compare EEG results with someone who does not have ADHD versus someone diagnosed with this disorder. For someone who is ADHD, EEG recordings will show more shifts in the right frontal region. Overall, the researchers state that neurofeedback as a treatment for ADHD can change brain activity in such a way that one can focus better and control their hyperactivity behaviors. They found neurofeedback to be without limitations. This study is going to compare the effects of both non-stimulant drugs and neurofeedback on patients with ADHD. For this study, 60 children were chosen from 2 ADHD centers in Hampton, Virginia, who have been diagnosed with ADHD. Because 15 children were already on medication, they were excluded from the study. The remaining participants will be split into 3 groups to receive the neurofeedback treatment and the non-stimulant drug. Before the study will begin, parents need to give their consent for their children to participate. For the study, there were a few materials used to measure some of the symptoms of ADHD. The IVA-2 rating scale will be administered to all parents of the participants. This allows them to assess the seriousness of their child's symptoms. Symptom choices include absent-mindedness, inattentiveness, hyperactivity, repetition of words, and fidgeting. A rating scale of 1 to 10 is given, with 1 being least present and 10 being more present. To measure attention, the integrated visual and auditory test is given. During this 13-minute test, stimuli appear on the screen, and participants will have less than 2 seconds to respond to the stimuli. To see what is going on in the brain, neurofeedback training is done over the course of 3 months with 4 sessions a week during this procedure. Participants will be seated in an upright position. Brain activity will be monitored by placing 2 electrodes on the head, 1 above the anterior cingulate cortex and 1 on the right hemisphere of the brain. The second group will receive a non-stimulant drug, clonidine, that will suppress the symptoms of ADHD. Participants will receive this drug 4 days out of the week for 3 months. After consent was given, the pretest was administered to all parents. The researchers then will explain the study to all children who are participating. Because of younger children, the instructions were explained in a way that would be understood. Also, researchers make sure the children are not only understanding but paying attention. 3 days after the initial meeting, the 45 children were put into 3 different groups completing the IVA, which took about 20 minutes. They did not have an unlimited amount of time to complete this test. Over the 3 months, the first group would complete the IVA and neurofeedback training in each session, and the second group would be administered the drug clonidine. The goal of this study is to provide an additional method to profitably treat ADHD. Neurofeedback increases attention in children. 3 months of neurofeedback treatment in clonidine were indeed successful with suppressing symptoms of ADHD in children. This study can lead to future studies helping to find a 100% effective of symptoms ADHD in children.